According to data found on scientistinsights.org, an estimated 70% of people across the globe will experience at least one traumatic event in their lifetime. These traumatic events can include, but they're not limited to, accidents, violence, disasters, or abuse. Today, I am here to inform you about PTSD, post-traumatic stress disorder, and a related condition known as CPTSD, complex post-traumatic stress disorder. While both conditions are connected to trauma, they can develop in different ways and they can affect a person in different durations. In this speech, I will explain three main points. My first being the causes and differences, my second being signs and symptoms, and my third being treatment options that are currently available. My first point about the causes and differences. First, it is important to understand what PTSD is and how it can come about. According to Mayo Clinic, PTSD typically develops after a single traumatic event that can be clearly recalled, such as military combat, a serious accident, a natural disaster, or an assault. However, complex PTSD develops differently. The Cleveland Clinic explains that CPTSD is usually linked to long-term repeated trauma, particularly during childhood or in situations where the person cannot escape the traumatic event. Some examples include chronic childhood neglect, long-term domestic violence, or prolonged exposure to community violence or captivity. While both disorders stem from trauma, key differences lie in the duration and repetition of each. PTSD is commonly associated with just a single event, while CPTSD is linked to an ongoing trauma over a long period of time. Both conditions originate from traumatic experiences, but CPTSD tends to develop after prolonged exposure, which can create harsher and more complex emotional effects. I've just gone over the causes. Now I'll talk about the signs and symptoms. Both PTSD and CPTSD share some symptoms, although they can appear in different ways. According to the National Institute of Mental Health, PTSD symptoms generally fall into four main categories: intrusion symptoms, avoidance symptoms, arousal symptoms, cognitive and mood symptoms. The first category, intrusion symptoms, which includes unwanted memories, flashbacks, or nightmares. The second category is avoidance symptoms, where individuals avoid places or peoples or conversations. The third is arousal and reactive symptoms, such as being easily startled or feeling constantly on edge. And lastly, there are cognitive and mood symptoms, such as feelings of guilt, negative thoughts about oneself or others, and social withdrawal. Complex PTSD includes many of these same symptoms, but it also involves additional psychological effects. According to PsychCentral.com, individuals with CPTSD often experience persistent negative beliefs, such as feelings of shame, guilt, or worthlessness. CPTSD can also involve significant relationship difficulties, emotional regulation, and long-term sense that the world is unsafe. Both of these disorders involve long-lasting stress responses that affect emotional, psychological, and sometimes physical well-being. I have discussed the symptoms, and now I'll discuss the treatment used for these conditions. Treatment options. My third and final point is that both PTSD and CPTSD are treatable conditions. According to the National Center for PTSD from the U.S. Department of Veterans Affairs, several forms of therapy have been approved. One commonly used approach for PTSD is cognitive behavioral therapy, or CBT, which commonly helps individuals recognize and change patterns of thinking that contribute to distress. Another treatment method is eye movement desensitization and reprocessing, commonly known as EMDR, which helps individuals process traumatic events, memories, in a structured therapeutic setting. Medication may also be prescribed in some cases to manage symptoms like anxiety and depression. Treatment for complex PTSD often involves a longer, more multifaceted approach. The Cleveland Clinic notes that therapies like dialectical behavioral therapy, EMDR, and internal family systems therapy may be used to address emotional regulation, trauma processing, and relationship patterns. Although recovery timelines can vary, research consistently shows that professional treatment can significantly reduce symptoms and improve life. In conclusion, PTSD and complex PTSD are two trauma-related conditions that affect millions of people worldwide. I've discussed three key aspects to these disorders. We've talked about the causes and differences between CPTSD and PTSD, including the role of single traumatic events and prolonged trauma. Second, we examined the common signs and symptoms, including intrusive symptoms, avoidance symptoms, hypervigilance, and emotional distress. Finally, we reviewed treatment options, including CBT, behavioral dialectical therapy, and EMDR. According to the National Center for PTSD, about 6.8% of adults in the United States will experience PTSD at some point in their lives, although the percentage experiencing trauma at some point is much higher. Understanding these conditions can help increase awareness in how trauma affects mental health and how treatment approaches are used to support recovery. Thank you.